Welcome to APSA's annual meeting 2021. It is my privilege to introduce Maria Cho as the next speaker for the top educational content portion of our annual meeting. 2 years ago, APSA leadership has decided to distill the top educational content into right-sized presentations, much like TED Talks. Maria is the CEO at Inside Out Medicine. She has a law degree, and she also has worked for the Gates Foundation. She's currently a member of the APSA Quality and Safety Committee and came up with a concept of quality toolkits 4 years ago. However, she is here today in her capacity as a mother while giving the talk for family-centered care. While navigating the complex health system as a mother several years ago, she learned very valuable lessons on how clinicians can empower families to help contribute to the best outcomes for their children. She will share this knowledge with us now.
How many of you get asked to improve your family satisfaction scores or give more family-centered care? And how many of you wonder, why is it, despite all the care we give, all the steps we take, that families still have delays in care and preventable complications? We can all agree. We all want every family to have the same opportunity for a good experience and positive outcomes, no matter what language they speak, no matter where they live, what their level of health literacy. So you ask, what more can I do? But I'm not here today to talk about what more you can do. Today, I'm going to talk about what more families need to do to eliminate those preventable issues and how to shift the responsibility to families and stop underestimating what they can do, and how shifting that responsibility benefits everyone, including stopping those ED visits and phone calls that you get at 2 a.m. Back in 2008, and I was 28 weeks pregnant, and it was the Friday before Mother's Day, I had a headache. So I took my blood pressure, and it was 170 over 110. I called the OB, and she said, you need to come in right away. And by the time I got roomed, my blood pressure was 240 over 190. The attending said, that's it, baby's coming out, you're headed in for a C-section. So a few minutes after midnight, on Mother's Day, we got to meet our son Kai for the first time. I only saw him for 2 seconds because he needed to go to the NICU right away. We had 11 weeks in the NICU, where he was getting treated for bronchopulmonary dysplasia, and anemia, and hydronephrosis, and neck, and sepsis, and many other conditions that are common to prematurity. This is our family on the day we got to take him home. My husband was so excited that morning to meet with the DME rep and get our portable oxygen tank. He couldn't wait to see Kai disconnected from the wall oxygen and take him out of that room, that F pod. That was the letter on the outside of our room. So I remember how thrilled we were when we got to walk out of that F pod. And our primary nurse grabbed a camera and took a photo of us. And that was the only photo we have of the three of us together that year, because the rest of that year was just so full. When we left the NICU, there were 120 weekdays left in the year. And during that time, we had 113 visits to the Children's Hospital for visits to see pulmonary, nephrology, GI, neuro, oto, ped surgery, rehab, and many more specialists. We got to participate in a lot of family conferences and a lot of rounds and discharge teachings and follow-up visits. You could say we got a lot of family-centered care. And they gave us information about surgery and listened to us and got to know us. We got information on what is a G-tube, how does it work? We got information sheets on formulas and feeding plans and pumps, pegs versus button decisions. So we got a lot of information. Being a lawyer and a project manager, I have to say the fine print matters. The details matter to me. So I don't mind reading through every piece of paper, and I don't mind spending a lot of time reading and learning. So I can deduce information, I can extract it, and I can organize what we need to do and when. Now, we felt involved at every step of the way. So every day when I came home from the hospital, I took my binder, I built this binder, and I put all the sheets of paper in there. I indexed everything. I read through every sheet of paper. I highlighted the important tasks that we needed to complete, and then I made a to-do list, and I sorted them by due date and priority so we could track everything that we needed to do. Now, my husband, he's a software engineer, and he was not going to do that. Now, I compare that to a family who does not have the overcompensating, hyper-organized Maria, who's going to go through every sheet of paper and make a to-do list for each member of the family. And I wonder, what is their experience like when they get all of those verbal explanations and stacks of paper? Is it clear and explicit to them what their job as a family is? Do they know the 1 or 2 critical tasks they have to complete now? And do they know what else they need to do and when to do it? If family-centered care is designed to create partnership between providers and families, it looks like half the equation is missing. For providers, your workflow is defined. You have order sets to make sure that important tasks get done. But where is the family's workflow defined? Where is their checklist? Do they know they have a job besides being parents? If it's not explicitly stated to the families that they have a job, they may not understand that they're on the hook for anything besides showing up. We need to shift to the position where we're saying to all of our families, ask not what your doctor can do for you, ask what you can do, so there can be partnership between both parties. Families need to know their jobs. And I know that many of you say, but I do this. I explain to families what they need. So why aren't families doing their job? It's because the instructions aren't clear. So where you live and breathe this every day, and it's clear to you what needs to happen, what's an upper GI, the families are not always clear on who's scheduling this upper GI, when does it need to happen, why is it happening, and that it can hold up getting a G-tube if they don't get it done. So if the families don't know their job and they don't have the context for everything that they need to do from the process and all the papers they're going to have to process, they'll put those papers in the diaper bag and they'll leave them on the kitchen counter, and it's easy to lose track. And so I think about the families with the single parent, or ones where they bring another kid to the consult and they're just trying to keep their kids from tearing your office apart. How do we give them a clear understanding of what they need to do so that they don't have to build these tasks and figure it out? Well, it's already been invented. Virtually every industry has solved this problem with step-by-step instructions on any topic. You can look up anything on the internet, and you can get step-by-step instructions, a list of tasks to do, and when to do them. If you look up in Google or YouTube and you enter "how do I" and fill in the blank, you will get lots of recipes and step-by-step instruction guides on just about anything. But if I search in there for "how do I get a G-tube," there are no clear 1, 2, 3 steps for the family on what they need to do. So in contrast, think about the boarding pass experience when you're checking in for a flight. When you're going to travel, the boarding pass experience tells you what ID you have to bring, what you're going to do at check-in, what you do with your luggage, requirements, when to board, what's expected when you're in flight, and then where the airline services end, and you need to arrange for transportation at your destination city. The boarding pass experience makes the passengers' requirements and responsibilities clear. It's not about what the pilot and crew need to do. And so it tells the passengers what they're on the hook for doing. And they do it. 20 years ago, did you ever imagine that you would be making travel reservations without a travel agent? You'd be printing your own boarding pass and tagging your own luggage and ordering your own Uber instead of getting somebody to call you a taxi? Offering a boarding pass experience, it creates equality because everybody is getting the same information. It levels the playing field. It also creates equity because it works for anyone. It works for the single parent, the parents who are working full-time jobs and juggling multiple things like homeschooling, care of elderly parents, or people who don't speak English. It works for everyone. We can do the same in healthcare. We could offer families a simple 1, 2, 3 boarding pass experience that shifts the responsibility to them. I've worked with many teams to implement a boarding pass experience. I worked with the nurses at Seattle Children's when they built a digital boarding pass experience for families needing a G-tube consult. Before, families often came to their consult without having completed the workups that were required to schedule surgery. In fact, 68% of families, including mine, had not completed these workups. After launch, only 3% of families had not completed these workups. The rest were all ready to be scheduled for surgery. This was a 96% improvement in the number of cases that could be scheduled for surgery. And we did this while reducing the nurse back office time for coordinating this by 1/3. This meant that the decision for a G-tube could be made during the consult, and families could avoid delays. And surgeons could fill their blocks and avoid having second visits and rework. At one of Seattle's surgery centers, I worked with their leadership team to implement an enhanced recovery protocol with the boarding pass experience. Before launch, the team wondered and worried if the families could do this. 2 months after launch, 94% of families complied with the enhanced recovery protocol. This disproved the team's worries. It's not that families can't do it, it's that they don't know to do it. And when they don't know, it's easy to underestimate them and assume that they're not capable. But with the explicit boarding pass experience, with the steps spelled out, we see again and again that families can do their job. And now the families that people thought couldn't or wouldn't do it are now seen as the most engaged and on top of it families. We need to change this across the board. There's no reason this can't apply to every condition in any setting. You could offer this for every procedure you do, every condition you treat for your families, and it would eliminate those middle of the night phone calls and ED visits for non-urgent issues. The boarding pass template that these teams used is available to you in the Quality and Safety Toolkit. The template works with your existing education. Just add it as a cover sheet on top of the education you give to highlight the key tasks your families need to do. My son is 12 now, and thankfully, like most kids his age, he's able to complete just about any task when he has clear step-by-step instructions. As he takes on more responsibility, my hope for him and for every family with a child who needs medical care is that they get an easy 1, 2, 3 boarding pass experience. When they're clear on the tasks, every family will have an equal opportunity for a good experience and positive outcomes. It's time to stop asking providers to do more to be better partners. It's time to make clear to families what their job is, so we can all have true partnership. Thank you.
Good afternoon, everyone. I'm Lauren Berman from Nemours Children's Health in Wilmington, Delaware. It is such a pleasure to be here today with Maria Cho. Maria and I have known each other for several years. I first met her within the context of implementing some quality improvement work around G-tubes, using the work that she had done with Seattle Children's. And I've learned so much from her over the years, and it's just incredibly humbling, inspiring, just to really hear Maria as a parent, over the last 15 minutes going over what she went through with Kai during that first year and how tough it was. And she is one of the smartest people I know, and I believe really has the potential to revolutionize the way we engage our patients and families in their own care. So I'm thrilled to have this opportunity today. As we're kind of waiting for some questions to start showing up in the chat, Maria, I was thinking that some of us, as we listen to your talk, may start to think, you know what, I already do this. We have great patient education materials, when we're doing advanced, early recovery after surgery, or our G-tube pathway. We already tell patients this? Like, what's so different about this boarding pass concept that you described today, above and beyond what we already do?
Right. So again, thanks to APSA for having me here. And thanks for that question, Lauren. I think it's a critical one because it's true that a lot of information is given to families and clinicians often worry about overloading them. But what's different about the boarding pass experience is, as I've seen across my own experience, but more importantly, across all of the hospitals and clinician and teams that I've worked with, the information that's given today is often about what you do, meaning what does your team do and when are you going to do it? So what should I anticipate? But it's not about charging me with a very specific, as a parent, with specific tasks on what I need to do and when. So things like, for a G-tube, as an example, ordering supplies, setting reminders to order them on time because they're not stocked at the hospital, right? Making a backup kit, checking the expiration date on that backup kit, making a plan for all the caregivers that are involved in my child's care, even the school nurse. Do we have a plan for what happens when the tube comes out? Who's going to be called? How quickly will this happen? How do we get this handled, right? So things like that. Even, what do you do if you have a leak? So it's making sure that parents understand what they're responsible for. And that's what's critical about the boarding pass. It is about saying, in order for us to partner, in order for your child to have the safest care, these are the things that you need to do in the home environment so you know what to do at 2 a.m. when that tube comes out. So it's really about what are we putting in the active voice, not the passive voice, right? Not these things will happen, supplies will be shipped, we've ordered them. It's you must do. And that's the critical piece. The verb on you must, right? You're responsible for.
So what do you think about families, who aren't project managers for the Gates Foundation and software engineers, and might be already feeling so overwhelmed, and then the providers feel like, how can we ask them to do more? How would you respond to that concern?
I think that's a top response I get from clinicians, actually. And it's a great question because I'm actually hearing two questions in there. And the first one comes back to the heart of, can they do more? And the second one is, should they do more? And on the first one, I would say, not only can they, yes, they can, they want to. You and I did a study with several other surgeons and Madeline Odison out of Houston in the Journal of Pediatrics on NICU families across the country that cross, every kind of, demographic, socioeconomic status, education level. The number one theme was that they wanted to do more. They didn't know what they could do, and they felt like they had to ask permission for it. So not only can they want to. I've seen them do it in numbers that astound you. Consistently, between 80 to 97% of families can do this. The next question is, should they? And that is, to your point of they're feeling overwhelmed. And I would say this, the number one way to get people out of feeling overwhelmed is to give them clear tasks and make it really step-by-step broken down into easy things, right? So I would say for our children, there are lots of things we wonder, should they do it? But if we want to raise them to be capable and confident, we train them well in advance. Right? You don't say, oh, you're 17. Now's the time to assume responsibilities for activities of daily living. We want them to practice, have the space to do it so they can feel confident. The same applies for parents. They need to practice, they need to own it, every task, and then you're there to back up and provide support for when they can't.
So we've got a lot of action in the Q&A box. I'm going to try to get some of these questions answered in the few minutes we have left. There's some questions about, I think a lot of the examples you gave had to do with more elective situations, like here's what I need to do to prepare for my G-tube appointments. But you briefly mentioned, doing this in an acute care surgery situation. Can you give an example of how you'd apply this concept, like for a child undergoing an emergency surgery, for example?
Absolutely. So I would still give them a boarding pass, right? If you're going to meet them, even if it's for 2 minutes to say, I'm going to take your kid back into the OR, I'm going to go back and do X, Y, Z, right? Whether it's appendicitis or something more severe and trauma. But these are the things I need you to do, right? So first, clear your schedule. I need you to be here. Know that we're expected, whether it's a one night or we don't know how severe this is, clear your schedule, make sure you're going to be here. Here's a discharge checklist, right? Things to prepare for.
And so you can start giving them not just education, but tasks on preparing transportation, who's going to need to be there, who do you need to communicate with, right? And then helping them they could be identifying even, who is their PCP? Do they have one? Do they need help with things? So the more we move it into self-service and saying, these are the 5 tasks you can do while you're waiting. So you're not just sitting there with anxiety and twiddling thumbs, right? Here's your responsibility as a parent. Start thinking about how you're going to manage pain. What matters to you? What comforts your child? How do you calm them? How do you want to talk to them, right?
Have you found any families that resist this idea because they think, I'm here and the job of the healthcare team is that they should be calling the DME company and they should be arranging the X-ray study, and why are they asking me to do this?
Absolutely. So the bottom line on this is, you're going to find families that resist, but the whole point of partnership is you have to do it. You're going to have to go home. You have to take care of your kid. Here's why we're asking you to do it. And then again, you provide the safety net for the families that can't or absolutely resist it. But like I said, if people understand why, then they will. 90% of them will. Thank you
so much, Maria. I believe our time is up. It's been such a pleasure chatting with you today, and thanks for continuing to teach us. We learned so much from you.
To participate.
Thank you.
Thank you so much, guys. That was so enlightening and such an interesting conversation, and really educational for us, just knowing how involved the families really do want to be. I think it gives new meaning to, there's an app for that too, because I think making things as easy as possible for everyone involved in the care of children just makes, really can elevate the level of care that we can provide as a team with these families.
Yeah, I saw Susan Yoder in the text box commented, and I think her word is perfect: empower the family to rise up and care for their child. They're going to ultimately have to do it. And I think giving them tasks makes them feel part of the team, and also a sense of accomplishment and contribution. So I think having that paternalistic approach is so 90s. We need to empower them and have them engage with us. Really powerful stuff.
Yeah, that was awesome. And I think every time you listen to something and you learn more and more, it's amazing. It's amazing how much we think we tell families, and we might tell them, but what do they grasp and how do they understand that and how do they process it? And I think this talk really enlightened me, at least, on that step in the process of helping take care of a family. And so, and that's our job, is to take care of families. And so I think the instructions, the detailed instructions and making that simple, I think is the steps, and that's process improvement. And take a task like the G-tube insertion sounds great, and then building on that. So I loved it. Fantastic.
Yeah, absolutely. I think the idea of a checklist too, that's being implemented in so many other areas of surgery and medicine, and handing that over to families to try to help them keep themselves organized and put it all in one place. I know we use the example of the G-tube pathway, but I hope that this expands to a lot of other different aspects of our care. I think it would be really beneficial. So I think that was just a fantastic talk.
And how neat is it to have a parent talk and give their perspective, something that we don't think about, or I mean, I think we think about, but we don't really know what it's like unless you go through that. And to see it through her eyes and her experience is just really compelling, and tells us how important it is to incorporate parents and improve what we provide through their eyes.
Yeah, I agree. And I learned a tremendous amount. We've had a parent advisory council for our team here, and you learn so much, and you have to make it a diverse group because everyone comes from a little bit of a different angle with different resources and different issues to overcome. And so learning from the families really gets you to that next level. In inflammatory bowel disease, there's a group called Improve Care Now that's very based on the same ideas of trying to reach goals, but having the families involved in reaching those goals. So just an awesome, awesome discussion.
Great. And I think having something like that, whether it's a checklist or some kind of a thing that you go through with the families after, I feel like the sense of accomplishment that they must have when they come to the office fully prepared and know what the next steps are and know what to do going forward, I'm sure is just such a relief for those families too. So I think this has just been absolutely a wonderful idea.
So I think next is Dr. Waldhausen's presidential address. Excited for this one. It's on a surgeon's purpose.
Make sure you go to the bottom of your screen and click on the next session. Otherwise, you'll miss Dr. Waldhausen's address, and you don't want to do that. We look forward to reviewing it in about an hour.
In detail.